If you have ever felt a gnawing, burning sensation in your chest or throat after eating a large or greasy meal, then you probably know the discomfort of heartburn. It is a common symptom caused by stomach contents filling back up into the esophagus. The stomach has a lining to protect it from acid, but the esophagus does not. There is supposed to be a valve located where the stomach and esophagus join, called the lower esophageal sphincter valve, or LES. When the LES malfunctions or is damaged, it doesn't close properly to keep the contents down in the stomach, where they belong. For those who have gastro-esophageal reflux disease, or GERD, the backflow of acidic contents can be ongoing, chronic acid reflux symptoms, including heartburn, a sensation of food moving up the throat or into the mouth, a bitter or sour taste in the mouth, persistent sore throat soreness, chronic coughing, difficult or painful swallowing, asthma, unexplained chest pain, bad breath, a feeling of a lump in the throat, and an uncomfortable feeling of fullness after meals. In more severe cases of untreated GERD, permanent damage can occur to the teeth as the harsh stomach acid erodes tooth enamel. Damage can also occur in the esophagus, larynx, mouth, or any part of the upper digestive tract that is regularly exposed to acidic stomach contents. GERD is very common, affecting approximately 13 to 29% of Canadians. The good news is that with a proper combination of lifestyle changes and medications, it is possible to manage symptoms and get relief. Dietary changes, while unable to cure GERD, can reduce symptoms. Fatty or spicy foods, alcohol, and caffeine tend to worsen symptoms. But everyone is different, so pay attention to what you eat and avoid foods that make you feel worse. You should also reduce meal size, as smaller, frequent meals cause less acid reflux than large meals. Maintaining a healthy weight, avoiding smoking, and reducing the amount you eat before bed can help ease reflux symptoms. While sleeping, use gravity to help keep stomach acid in the stomach by propping up the head of your mattress or bed frame. Don't just pile on the pillows, though, because this can cause neck and back pain. These changes are a great starting point, but many people with GERD require further treatment. There are two main approaches to treating GERD with medications: neutralizing acid and blocking its production. Over-the-counter medications are useful for neutralizing acid. These antacids can provide quick, temporary, or partial relief, but they do not prevent heartburn. Main causes are: 1. Low stomach acid causes bacterial overgrowth. As I will explain in the next article, one of the chief roles of stomach acid is to inhibit bacterial overgrowth. At a pH of 3 or less, the normal pH of the stomach, most bacteria can't survive for more than 15 minutes. But when stomach acid is insufficient and the pH of the stomach rises above 5, bacteria begin to thrive. The Gastrin knockout mouse, which is incapable of producing stomach acid, suffers from bacterial overgrowth. 2. Low stomach acid causes maldigestion of carbohydrates. Stomach acid, HCl, supports the digestion and absorption of carbohydrates by stimulating the release of pancreatic enzymes into the small intestine. 3. GERD is caused by increased intra-abdominal pressure. It is well accepted in the literature that GERD is caused by an increase in inter-abdominal pressure, IAP. Acid reflux occurs when pressure causes gastric distension, stomach bloating, that pushes the stomach contents, including acid, through the LES into the esophagus. According to current thought, factors contributing to this include overeating, obesity, bending over after eating, lying down after eating, and consuming spicy or fatty foods. To summarize, low stomach acid contributes to bacterial overgrowth in the bowel, which in turn can lead to carbohydrate malabsorption due to decreased pancreatic enzyme secretion. Malabsorption of carbohydrates, as Dr. McCarr has pointed out, increases inter-abdominal pressure and causes GERD. Reducing bacteria loads and limiting carbohydrate intake have been shown to greatly improve, and in some cases completely cure, acid reflux and GERD. Homeopathy is very proficient in managing all the symptoms of acid reflux, and furthermore plays a vital role in preventing relapse of the condition. Homeopathic medicines are prescribed on the basis of physical, emotional, and genetic makeup that individualizes a person. This constitutional approach, framing mind and body, works at the root level. Homeopathic medicines will help decrease acidic buildup, rebalance pH by cleansing and restoring the digestive system, and strengthen the lower esophageal sphincter. Homeopathic treatment will help you feel like a new person by making you free of acid reflux, GERD. Homeopathic treatment is natural, safe, gentle, and without side effects. Homeopathic medicine relies not only on identifying the symptoms of the disease, but on a variety of personality traits, the person's mental state, and other characteristic symptoms a patient exhibits which correlate to any particular remedy. When choosing a correct remedy for the treatment of heartburn, look at all aspects of the patient. Homeopathy relieve acid. Regulate the normal secretion of HCl from the gastric gland, thus maintaining a normal HCA level in the stomach. Homeopathy treatment relieves the stomach pain, cures the belching symptoms, relieves the burning chest, relieves nausea and vomiting, cures the flatulence, improves appetite, relieves abdominal distension, cures the gastric headache. Since homeopathy treats in totality, it leads to a permanent, long-lasting cure rather than a temporary suppression of symptoms, and you'll be able to enjoy all kinds of food to the fullest. So food lovers, you won't have to think anymore before eating.